Sri Lanka's public health services and hospitals are battling the worst outbreak of mosquito-borne dengue in a decade, and turning to the island nation's armed forces to help curb the spread of the disease. From Air Force drones tracking stagnating rooftop pools of water after monsoon rains, to military and police officers helping to inspect homes, building sites, and schools in a campaign to stamp out mosquito breeding sites. With 53 deaths and 76,044 infections since it began in January, the numbers of the stricken, spread wider by a more virulent strain, are approaching the tally of more than 100,000 notched by a 2017 outbreak. Hospitals have rushed to add beds, convert wards to care for the ill, and step up hours worked by doctors and nurses in the battle to treat an influx of more than 18,000 cases in the first 2 weeks of July, health authorities said.
I had some instructions from my family doctor. Then he asked me to stay at home because my the platelet count is not too much down. Then I did my home meditation at home because too much patients are in the hospital.
June's tally of 21,537 infections, usually characterized by high fever, body ache, and loss of appetite, was more than double the figure in May. But Sri Lanka has yet to introduce a vaccine. The heightened strain comes in the aftermath of Cyclone Ditwa, the nation's worst natural disaster, which tore up critical infrastructure and health facilities in late November, causing losses estimated by the World Bank at $1.4 billion.
It's challenging to the doctors because it's a rapid increase of patients. Like all of a sudden you get a big bulk of patients coming into the hospital. So it's challenging. So challenging to the doctors, nurses, the health administrators, everyone. So because you have to use the same resources that we had before.
Health officials expect infections, typically boosted in rainy season, to ease off as monsoon rains weaken in August, but warn they could climb from November as rainfall returns to the island in its second annual monsoon season. On Thursday, July 16th, the government targeted cleaning up of the worst affected regions, combing sites from homes to religious institutions to eliminate sites where mosquitoes breed, authorities said. With its drones helping public health officials identify rooftops where water collects, as well as monitoring larger areas, the Air Force is also helping overstretched staff at some public hospitals to keep track of patients. Nearly 11,000 mosquito breeding sites were cleared this month, with fines levied at more than 4,000 premises found to harbor them, the health ministry said. Authorities are also considering turning to a dengue vaccine, though experts have warned it may confer limited benefits as the virus is complex and several strains are circulating.